Good morning, everyone. I am Dr. Gaurav Mandhan from Miracles Apollo Cradle Hospital, Sector 14, Gurugram. I am heading a department of pediatrics and neonatology at Apollo Cradle Hospital. Today, we are going to discuss a very common topic that is neonatal jaundice. There are a lot of myths about the neonatal jaundice, which I am going to talk about today, and we will talk about some what are the main important causes of neonatal jaundice and how to treat neonatal jaundice if at all baby requires treatment for it. So coming to it, almost maybe you can say 80 to 90 babies out of 100 babies develop some amount of jaundice during their neonatal period. So you might ask a question that why so many babies are developing jaundice. Almost there are multiple reasons for that. The first reason is that these newborns are born with a little high hemoglobin and their red blood cells are little immature, due to which they break down more and there is the production of bilirubin. Bilirubin is what is responsible for causing jaundice in these kids. So these bilirubin productions are higher in these babies, and there is also this bilirubin is excreted from the body from by the liver through intestine as well as through urine. So this liver is also little immature in the neonatal period, and it matures by 1 to 2 months of age, by which age the newborns or the kids are able to clear their bilirubin off their blood in a better way. The third reason is during initial few days that kids are getting little less feeds as the breast feeds are not that robust in amount during initial few days of life. Hence, there is one pathway called the enterohepatic circulation. The jaundice which is excreted in the intestines gets back to the blood and can increase the levels of bilirubin in these kids. These three are the most important causes for jaundice in physiological jaundice in the kids. So the second, in case there is some blood group incompatibilities between the mother and the baby, that is also a cause for a jaundice. But that causes pathological jaundice. If these are the causes, the kids develop jaundice usually within first 24 hours of life. Like the mother is O positive and baby is A or B positive. If the mother is Rh negative blood group and the baby is having a blood group which is positive, it could be either O, A or B, any positive. These kids they are actually at high risk of developing severe jaundice, so should be screened with some blood tests from the very first day onwards. Let's talk about how to treat this jaundice. The most important thing, first we'll talk how to prevent the jaundice, physiological jaundice going into the pathological range. So the first and foremost important thing, you should be having a blood group of the mother in hand, even before the delivery, so that we can categorize the baby soon after the birth, whether the child is at high risk or the low risk of developing jaundice. Second most important thing is you have to ensure adequate feeding to the kids, and you need to daily check their weight to check for any dehydration signs the child is having. And in case the baby has lost excessive weight during the initial 5 to 7 days, this could be due to the inadequate feeds, which can lead to the increased jaundice called as the breastfeeding jaundice in these neonates. So feeding is the most important criteria, I would say, which we should be taking care of during initial few days, which can lead to the which is the way to prevent jaundice be taking care of during initial few days, which is from going into the pathological range in the neonates. So nowadays we are screening all the newborns which are delivered in our hospital with a machine which is called as the transcutaneous bilirubin. So this is the machine which helps us to check the newborn baby jaundice levels just by touching the skin on the skin surface. So we do plot these jaundice levels, whatever is there on the charts, and depending upon the levels, we recall the babies on with the range which can last. If the child is having jaundice levels within high risk, so we might have to call within 24 hours next day to recheck the jaundice, or if the jaundice levels are in the low risk, we might call them after 48 to 72 hours to recheck what is the peak bilirubin these babies are getting. In case at any point of time, in case the jaundice levels are high with this machine, we do check them we confirm that these machine levels with a blood report, and then depending upon the blood levels, we do treat these babies. We do have some nomograms. We do follow, American or UK guidelines to treat these babies. And in case we have charts available, in case the chart at appropriate age, at particular age, the jaundice for that age is above the treatment level, we do treat them with the phototherapy. Some kids who are having very high bilirubin levels, like about 25 or 30, these babies sometimes they might need to change their blood completely. So this procedure is called as exchange transfusion. So that is the most important procedure. Now many parents, they do ask us that, even at 1 month of age, their child is still having a little bit of jaundice. Especially this jaundice is very common. This is called as the breast milk jaundice. It's very common at around 1 month of age. The minimal amount, like 5, 6 or 7, 8 bilirubin level might be persistent, which is due to the continuation of the breast milk. But that doesn't say that we should stop breast milk. Breast milk should be continued in all these kids, and this is the normal levels. The last thing I would like to talk about is we should check about, in case the jaundice levels which are in the pathological range are persistent, we go beyond 2 weeks of age, we should be looking of some special tests to diagnose what is the cause of jaundice in these kids. And lastly, the most important thing we do screen for these kids is we do tell all the parents that they should be checking the stool's color during first 1.5 months of age. In case the stool colors turns white and child is having a persistent jaundice, these kids should be screened for some liver disorders, which could be the reason for this persistent jaundice and white stools. So thank you very much, everyone. In case you have any other further questions about the neonatal jaundice, feel free to call or feel free to contact us. Thank you.